really is a privilege for me to be here today with all of you, so many of whom I already know, and others I'm looking forward to get to know better. My mentor, Dr. O'Hara, always says, when you're going to speak in front of a group of people, first tell them who you are and then tell them how you got there. So just briefly, I'm Tracy Fritz. I grew up in New England in Massachusetts, where I went to school for undergrad and for medical school at Tufts University School of Medicine. And then I did my residency in family medicine with the United States Navy down at Naval Hospital, Pensacola, where I met my husband. And after we served in the Navy together as physicians and did some overseas duties, we came back and settled in St. Louis, because that's where Barney is from. And that's who I am briefly. And how did I get here? Well, this is how I got here. That's Louisa. Barney and I had a beautiful daughter, and still do. When she was 18 months old, she had a very severe developmental regression, which continued, and she was diagnosed with autism right before her 3rd birthday. That was in April 2009, and in May 2009, I attended my first, what is now MAPS conference, where I learned from the clinicians and researchers about the neurologic, immunologic, and gastrointestinal disturbances that children with autism have, and how treating those in a clinical setting could really improve the function of those children. And that was the first time that I heard and began to learn about pandas. But it was just the beginning, because what I didn't understand then was that pandas would become even more important to me when, at age 6, Louisa had the sudden, debilitating onset of anxiety, OCD, motor and vocal tics, bedwetting, phobias, and what we believed was hallucinations when she would run into my bedroom and lock the door behind her and say, is Marju gone? And some of you may know that Marju is the big scary bear from Disney. So I had been learning, and I had been starting to treat patients with autism, and using a model in my primary care clinic, where I would typically see 25 patients a day doing full scope family medicine, and word of mouth in the parent community travels quickly, so I started to see children with autism and work on their underlying health to try to improve their function, and then I began to see patients with pandas as well. And it was quickly apparent that I was not able to deliver this type of care that takes so much time, so much detail, so much effort, so much communication and documentation in a clinic where I was expected to see 25 patients a day. And so Barney and I together made a decision for me to leave our very successful, very satisfying family medicine clinic that we'd started together with no patients and had grown over 8 years, so that we could open up a private clinic where I could do this kind of work. And we felt led to do it, and we felt that it was important to do, and we knew that in order to do it, Barney had to stay at Mercy, which is where he is, supporting us, because as Margot mentioned, you know, it's challenging to do this work in a setting, and you do it because you want other families to not go through what you went through. And I will say that Louisa was treated by Dr. Kavesevich in Chicago, who was a godsend, and she still has many challenges. However, after her first IVIG, I think it was maybe 1 to 2 weeks, and she had complete resolution of her motor tics and has continued to improve steadily, along with a lot of other supportive treatment. And that's really what I want to talk to you all about today, because we've had such amazing information from all of the physicians and researchers that have been here. And I think what I'd like to add is my perspective in terms of what we call integrative or functional medicine, which is really just trying to look at all of the pieces for an individual in their body and in their family and their community, everything that affects a patient, and to try to address those things to facilitate healing on whatever protocol they're on. I'm just going to give you an overview of what I'm going to talk about. The concept of homeostasis, which is balance versus imbalance, and then basic foundations that I think are important for all of us, our children especially when they're sick and they need to heal, of sleep, stress, and nutrition. And then I'm going to go through the body system foundation, which I mentioned earlier when I talked about what I began to learn in my autism conferences, which is the neurologic system, the immune system, and then the gastrointestinal system, which I will call the gut from now on. And then, if I have time, I want to talk about the cellular foundation, which is really how the body runs in a very tiny way, but a very powerful way. And then just talk about homeostasis again. So now I didn't mention I was an English major and I'm kind of a word nerd. So I love definitions, but I also think definitions are important because then we can all understand what we're talking about. So I'm going to read you the definition. I know you all can read the slide, but homeostasis is the tendency of an organism or a cell to regulate its internal conditions, usually by a system of feedback control so as to stabilize health and functioning regardless of the outside condition. And so the concepts that I want you to think about as I start to talk about what I recommend patients to do is that the body is designed to heal. You know, you can cut yourself in the kitchen with a knife and you have no doubt that that cut will heal, but a lot of complicated things have to happen to make that happen. We take it for granted. And so all the time our body's responding to what's happening in the environment. We have stress, we respond to it, our body adapts, we're balanced again, and we're healthy. If you get a response and your body can't respond to it in an appropriate way, things become imbalanced, and that's what we consider disease. And so disease is defined as the inability to return to a state of homeostasis. As I said earlier, the body has mechanisms to restore balance, but sometimes the illness itself disrupts that. And if it's an immune system disorder, then it certainly can be very tricky to get the body and the immune system working like it's supposed to again. So the interventions that I'm talking about are aimed at trying to support the body's ability to do that. And I'll say before I move on, I mean, when I treat patients, I do the workups that were talked about here, you know, the complete serologic workups. I also do some additional things I'll talk about, and then whatever the appropriate treatment is for that child, you know, I'm able to do IVIG if that's an indicated therapy for the patient, but this is also, in my mind, an extremely important part of the treatment plans that I do for patients. And I'll also add that, you know, I don't do research in my clinic, I mean, other than an N of 1, which is, I rely on the education that I get at conferences, on the papers that I read that are published by the fabulous physicians here, but I learn the most from my patients. I'm a clinician, and we practice medicine. And I hope that what I can share with you today will empower you to leave here feeling like there's things you can do in your home for your children's health, and hopefully that's the result of what I've learned by taking care of patients who have PANS and PANDAS. So basic foundation, sleep. I'm going to torture you with definitions. Okay, everybody knows what sleep is. We all sleep, but I just want to talk about really what happens when you sleep, okay? It's the natural periodic suspension of consciousness during which powers of the body are restored, right? So you sleep, you need to rest. It's characterized by changes in our brainwave activity, our breathing, our heart rate, and, you know, other physiological functions. I guess, you know, we all know that. But there's certain things that your body does when you're sleeping that are associated with digestion, with the ability of your cells to repair, with growth, and with immune modulation. So we heard already how important sleep is. And I'm going to talk about the things we can do to make sure that our kids are sleeping when they're trying to heal. So obviously you have to sleep to heal. Sometimes the sleep problem is the result of the illness, and so you have to address those sleep problems. But then as you improve and heal from the illness, normal sleep is restored and you may not need all the supports anymore. We talk about a concept called sleep hygiene, which is basically just make an environment that facilitates sleep. For the children, try to have a routine, make things quiet, calm, dim lighting, minimize electronics. And I'm going to talk in a little bit about the iPad and Minecraft and all the things that we know our kids need. But when you're gearing up for sleep, you do want to minimize the electronics because that visual stimulation really works against what we're trying to accomplish with sleep. One of the things I love and I usually encourage my patients to do is, if the child is willing, to put them in a bath with 1 or 2 cups of Epsom salt. That's magnesium sulfate salt. It relaxes muscle, both smooth muscle and skeletal muscle, so kind of your automatic muscles you don't think about, like your digestion, but also your muscles that you've been moving all day. You know, kids carry around a lot of tension. They have a very high sympathetic tone, you know, that fight or flight response is on. And sometimes in a Epsom salt bath for 15 or 20 minutes, it can really help reset that switch from the sympathetic tone to what we call the parasympathetic tone, or just relaxation. You know, if you're in fight or flight, you can't be relaxed. It's one or the other. And so we always are trying to trick their body to going into that relaxed mode. Another thing I really like to use, and I find, you know, very effective in my clinic, is essential oils. And, you know, I'll say this now, and I think oils seem relatively benign, and I believe that they are. But sometimes when you're practicing clinical medicine, you always want to use what we call the precautionary principle, which is above all, do no harm. You know, do not leave your patient in worse shape than when they met you. But if you know that something is safe, and you know that it may have a benefit in some individuals, I think that it's worth trying. And a lot of the things I'm talking about are like that today. So, and you know, essential oils have been used for thousands of years. So you can, if your child will let you, you can give them a massage. Certain oils are very relaxing, like lavender, chamomile, ylang-ylang. And I put a few resources on these slides, which this presentation will be available on my website as a PDF tomorrow in case you want links. And this, I'm not endorsing any one product over the other, but you know, people tell you to do things and then you don't know how to put it into practice. So Young Living is a nice manufacturer of very nice quality oils, and I like their page because they have a lot of education. So, okay, you can try those nice natural remedies to try to facilitate sleep. And, you know, please understand that for 3.5 years, Louisa stayed up till midnight and woke up between 3:30 and 5 a.m. while I was working full-time. So I know the value of sleep, and I know that, you know, it's hard sometimes when the child has so much immunological and neurologic disruption to get them to sleep, but these are things that we can continue to try until we can restore their normal sleep cycle. So over-the-counter medicines, and of course I would hope that you would do this in consultation with your own physician. But usually these are best given about 20 or 30 minutes before the child is going to go to sleep. Melatonin, we've seen other doctors talk about it, but that's a naturally occurring brain hormone that puts you to sleep. The dose we usually use in kids is between 3 and 6 milligrams, and in my experience, if 5 or 6 milligrams doesn't work, then 10 isn't probably going to work either. So I usually start with 3 and find that if melatonin is going to be effective for somebody, that's pretty much the dose that works. If it's a bigger child, then I'll try 6 sometimes. Ibuprofen. We've heard about this as a non-steroidal anti-inflammatory. It really does help a lot of individuals who are having pain symptoms. But it also has a side effect of sedation, of making you sleepy. You know, in the Navy, we had to give pilots a down chip, and meant they couldn't fly if they were taking ibuprofen because it is sedating. So we want to take advantage of that side effect in our children. I like to use a liquid medicine, even in kids who can swallow pills, because the onset of action is a little quicker, and of course I always recommend a dye-free formulation. And then Benadryl, not for extended use for sleep per se, but it can be really helpful when a child's having a sleep disturbance. Especially, I find an increased effect when you mix the Benadryl with the ibuprofen. And then, if the over-the-counter medicines and the natural remedies aren't working, sometimes we move to prescription medications. Atarax is really one of my favorite medicines in PANS because it's very similar to Benadryl. It's an antihistamine. It is prescription though. You need a prescription from your physician. It has a more potent anti-anxiety effect than Benadryl does, and a slightly more sedative effect, so it's really good to use at bedtime. Another trick I learned, which I have found to be helpful with my patients, is if they have a lot of anxiety, if the child has about a procedure or a blood draw, you can give a dose of ibuprofen combined with Atarax, and it can just bring their stress level way down, where they can be successful at doing something that perhaps before would take 4 or 5 people to hold them down for a blood draw. And I think because it's relatively safe, it's worth a try. Another prescription medicine we use frequently is Clonidine, which is an alpha blocker. It's an old medicine, was a blood pressure medicine originally, and it's been used in pediatrics for a long time. And if a child's on a stimulant, you know, needed for ADHD symptoms, that can sometimes interfere with sleep as well, and Clonidine is a nice medicine that's usually well tolerated. This has been mentioned already a few times, but if a child is having problems during sleep that you think might be related to sleep apnea, which would be maybe they have these big, huge tonsils or adenoids, they're snoring, they're breathing through their mouths when they're sleeping, or if they are having fitful sleep, kind of acting out their dreams, they may have that REM sleep behavior disorder, and that is amenable to treatment with melatonin sometimes, and sometimes a very low dose sleep medicine, a benzodiazepine. But I think that that's important to ask your physician for a referral for a sleep study if you see those issues with your child. The other thing that I check a lot is a ferritin level, which is an iron level. I'll get to it in a little bit, but our children often don't have very good absorption of their nutrients because their guts aren't in great shape. And if you have a low ferritin level, that's one of your iron stores, that'll give you restless leg syndrome. And sometimes an iron supplement can change the sleep pattern. And so that's an easy thing to do, and I think every child deserves a ferritin level if they're having trouble sleeping. And then, as I said, I try to look at gut issues to try to help with sleep issues. Okay, stress. So, I don't have to tell any of you really about stress, but physiological stress is defined as any external or internal condition that challenges the homeostasis of a cell or organism. All right. So, stress can make the immune system further dysregulated, and decreasing the stress can improve regulation of the immune system. All right. And so what kind of things can relieve stress? Well, movement, exercise is really good. I mean, when our kids are well enough, we really want to encourage them to walk and swim, jump, bike ride, if they do sports and they enjoy them, whether it's with individual or by themselves, to try to encourage that kind of movement. And then emotional stress, I talked a little bit about that sympathetic, parasympathetic mode, that fight or flight versus being relaxed. Recreation helps with that. And there's also techniques of deep breathing. I mean, that is one of our little physiological tricks. If you're in that fight or flight mode, deep breathing on a count of 8, repeated a few times, actually changes your nervous system so that you are almost forced to go into the relaxation mode. But what's funny is, when you're in that stress mode, you don't really want to deep breathe. You're going to do that later, just let me do this first. But it's something that you can teach the kids if they feel like it's coming on to take their breaths. And I laugh sometimes when Louisa gets upset and then before I can even say anything, looks at me and says, I don't want to take 3 deep breaths. And so you can teach the kids some yoga techniques, which are very effective because that's breathing and movement combined together. And if there's something that they like that will help them relax, then try to do it with them if you can, even if it's watching Dora for the 800th time. And I think this is an important concept that I wanted to share. Events that seem like fun or low stress for us may be extremely stressful for our children, and it actually may trigger negative behaviors in them. One of the big sources of stress in our kids is sensory overload. And I think it's a hard thing to really understand if you haven't experienced it to some degree. And remember that when our children are affected by these symptoms, their ability to communicate with us what they're actually experiencing is really impaired. And I know that many of the parents in the audience have learned that as their child improves, and then they communicate, oh yeah, I was seeing this, or I felt this way, or oh yeah, I could hear the bird flapping its wings outside my window. Well, you can imagine when somebody's talking right at their face, they might be overwhelmed easily. So sometimes it seems like a mystery why the behavior will suddenly change. But sometimes if you're a good detective, you can look and figure out that actually it was a sensory disturbance that started it. So this is a story, and this is about a young woman who she had autism, and this was a while ago, so I'm not really sure. Who knows exactly what had caused it for her? But in any event, she recovered to full function. But she had severe sensory distortion when she was little, and as she improved, there was a big thunderstorm. She went out in the rain at like 10:30 at night, and her parents said, "Georgia, why are you out in the front yard spinning around in the rain at 10:30 at night?" And she answered, "Because the rain doesn't sound like machine guns anymore." And so what I really think is fascinating about this story is, can you imagine if rain outside sounds like machine guns? You're really not going to want to go outside. And this fascinating young woman had been institutionalized for a while for treatment, and one of her really problematic behaviors was when it rained, she would try to fling herself out the window. And of course, she was restrained, and it was really traumatic for her. And what she communicated later when she was fully verbal and able to talk about her experience was that she had been paying attention in class and had learned about monsoons. And when she heard the rain to this level that it was to her, she thought there was a monsoon and she was trying to get herself to safety. And this really gives me pause, because when you look at some of the behaviors that our children engage in, and obviously I'm not talking about OCD-driven behaviors, but sometimes it seems bizarre or nonsensical, but actually for the child, sometimes it's a very intelligent, thoughtful response to what they're experiencing. Like, just briefly, as Louisa was improving with her autism symptoms and being much more communicative and able to, interact and go places with me, when we'd been to the grocery store, I think maybe one time successfully, which was a big deal because grocery stores were off limits. And so I pulled up in the minivan. This was at our local Schnucks, and I wasn't aware it had recently rained. And so I opened up the door, and I went to get her, to pull her out of the minivan and go, and she's had an absolute breakdown. And very, very resistant, just a complete breakdown. And so I put her back in the van. I was still standing outside, and I didn't look at her, because it can be overwhelming when a child's in an episode like that. I just whispered kind of quietly in her ear, "What's wrong?" And she said to me, "It's too loud." And I had to look around, and I realized that because of the recent rain, the ground was wet. Everybody was pushing their shopping carts, and it was so loud. The tires from the cars going on the wet pavement was extra loud. And there was a bagger who had 20 carts, and he was pushing it toward the door. And as I stopped to appreciate the sound, it was overwhelming. And at that point, I was able to say to her, "It's okay, it's loud, it's because of the rain, I understand." And she, thank goodness, has been blessed with a great sense of humor. So I did something to make her laugh, and I said, "Let's try to run as fast as we can." And I actually carried her and kind of did just my best, comedy routine as we ran in, and kept reassuring her that once we got inside, it would be quiet. And it was, and she made it successfully inside, and she's never had that issue with going into the grocery store since. But I look back and realized that that was a huge issue for her. The sensory overload in the parking lot, which to me was something I couldn't even conceive of. And so I talk to parents sometimes, and they're frustrated because they're trying to do nice things for their children. They want the family to go on a walk, or they want to go, on a nature walk through the woods. But if the child is smelling the dirt and it's absolutely repugnant to them, it makes them feel like they're going to vomit, they might not want to go on the nature walk with you. But they can't necessarily communicate that to you. So we really do have to be detectives, and just remember to look at the sensory world. And I usually encourage people to watch a sensory overload video just to get an idea. Police have to go through this training so that they can understand if somebody has sensory problems, how to deal with them. And I don't know if this is going to work, but I'm going to try. But I will say that, forgive me in advance, if you do have sensory overload problems, you might want to step out just during this 1-minute video, which is designed to try to give people like us who don't have sensory disturbance an understanding of what our children are experiencing. Oh, I got it, thanks. I think I got it. Oh, yeah. I keep doing it. I'm going to start at 15. Oh, gotcha. All right. It has to be loud to work. This is Walmart. Not really playing like it's supposed to, but the link is on the presentation, and if you have a chance and you have some headphones or good speakers, I would really encourage you to watch it. And there's lots of them available on the internet, and I think that then it might change the way you look at things in your child's world. So basically, you really want to work on stress management, you want to be aware that sensory changes can trigger emotional stress, but that also changing the sensory environment can decrease an emotional response. And I mentioned earlier iPads, Minecraft. I mean, obviously as parents, you know, we're trying to be good. You know, they tell us don't let them do more than an hour, 2 hours max a day on TV or video. But you know, our kids are in such a bad way. And I've had many patients tell me the only time I feel normal is when I'm playing Minecraft. You know, or the only way that I feel calm is if I'm watching the iPad. So I think that, you know, this has to be in balance with you know, keeping the symptoms confined. But I think that, you know, you can let yourself off the hook a little bit if you're trying to follow the normal guidelines. We're not in a normal situation. So make it very individualized for your child. And you need to allow yourself opportunities to relieve physical and emotional stress. And you know, I know that this is hard. This is difficult to do. But if we're the ones taking care of our children, we have to take care of ourselves. And I also understand that, you know, sometimes I'll tell a parent, you know, you should take an Epsom salt bath too and put some lavender oil in it. And they look at me like, you know, I'm crazy. Because, you know, there were times where Barney and I couldn't have a conversation with each other because Louisa perceived it as screaming. Or a time when I just couldn't speak with him at all because she couldn't tolerate me talking to anybody else. You know, or I couldn't, you know, leave the house because she was so afraid. But, and so during those times, you have to do the best you can. But those probably aren't the times you should be on the internet till 2:30 in the morning, and trying to learn more. You know, rest when you can, and even when you're in these crazy circumstances, you know, maybe try to find something that you can have a laugh about or a smile about. Because even when our kids are so sick, they're still who they are to me. So she always makes me laugh. Okay, nutrition, and this is a big issue, you know, a big concern of mine. So of course, nutrition is taking in food, right? Taking in food and using it for growth, metabolism, and repair, and that's what we need to do when we're healing. And the concepts are that in order for your body to work, you need nutrition, and nutrition requires food, and it also requires a healthy, functioning gut. And there's a big concept for me, which is what is real food versus artificial food. Real food, as it's defined, is carbohydrates, fats, and proteins, as well as minerals and vitamins that are taken in and used by the living body for growth and repair, and as a source for energy. You know, a lot of our kids don't have good energy. So we need to feed our children real food, and we need to eat real food. And I think in our times now where everything is, we're all under so much pressure, we all work so hard, we don't have time. A lot of times both parents are working outside of the home, and meal preparation is not what it used to be. And where we get convenience in many ways, we have to be aware that we're giving up something, and that's actual nutrient value in food. And when you're sick, your body needs nutrients, so you need real food. Okay, so what is real food? Vegetables, fruits, nuts, seeds, legumes, grains, fats, oils, animal protein, and animal milk. And I personally think that organic matters. Now, it's expensive, and I'll talk a little bit about how you can kind of pick and choose where you're going to spend your organic dollar, because some foods it's more important than others. But we don't know what a lot of these novel chemicals, new chemicals made over the last 20 years, I think the last toxicology conference I was at was 150,000 novel chemicals, not regulated, not studied. We don't know how these affect us. And there are so many of our foods, even in products that we use, that if you're trying to minimize the stress that your immune system is experiencing, then you don't want to introduce things that don't naturally occur when you have a good alternative. In fact, a better alternative, which would be what Mother Nature made for us to eat. When you're shopping, an organic product will start with a 9, and one that isn't organic starts with a 4. That's an easy way to look. And I already talked. I'm going to go a little faster through some of these slides because I want to be able to get through the whole talk. But basically, just be aware of artificial ingredients, and when you can, try to choose something that actually occurred naturally. It's going to be a lot easier for the body to get the good nutrients it needs from it. So this is from the Environmental Working Group, and they call it the Dirty Dozen, which are the 12 foods that are highest in pesticides, and then the Clean 15, which are lowest. So, you know,